Stefano and Antonio Vida were our main partner in studying cognitive remediation that is now inserted as a highly rated intervention in European guidelines for the rehabilitation of schizophrenia. And he applied the modality of this kind of rehabilitation of basal functions in schizophrenia and the change in language.
Okay. Good morning. No, the microphone, sorry. Pointer is here, okay. No, it's not connected, but no problem. I changed a little bit. Good morning, everyone. Thanks to Professor Cavallaro for his kind introduction, and many thanks to the organizers of the discourse. And it is a great pleasure for me to be here and in Europe to be here in a so relevant and international meeting. My talk has the following title: Language and Communication Disturbances in Schizophrenia Spectrum Disorders, the role of different modalities of cognitive remediation interventions. I try to go on, but it doesn't work. I don't know. Perhaps with the mouse? No. Okay, thanks. Okay, this is my outline. I address language disorder in schizophrenia with main interest on cognition in schizophrenia. So the link between language and cognition. Also in the assessment, and then in the rehabilitation, and with some research proposal for the future, or the present or the future. And let's start with the language disorder in schizophrenia. We know that they are a core feature of schizophrenia, with more than 70% of individuals with this disease that present communicative impairment that affect all levels of linguistic processing, as you can see by the slide. And furthermore, language disorders show extensive correlation with cognitive, not only, but also positive, negative, and symptoms, and also with psychosocial functioning in this population. Moreover, speech disorders, also known as formal thought disorders, in schizophrenic patients, we can see an alteration in the following three dimensions, considering speech disorder as a multimodal construct. So there is an alteration in thought, language, and communication. In this slide, we can see the psychopathological perspective, in which language disorders are considered as a psychopathologic expression of schizophrenia, like Armando D'Agostino said before. In particular, we can categorize formal thought disorders in two constructs, the positive one and the negative one, as you can see by the picture. In this meta-analysis that included 13 studies and 1,478 patients, you can see an inverse relationship, and it's interesting, between thought and language disorders and psychosocial functioning in schizophrenia, with a small to moderate effect size. And here you can see the forest plot of the inverse correlation. From a neuro-linguistic perspective, language is a complex construct and it is composed by several sub-dimensions, such as syntax, morphology, phonology, semantics, and pragmatic SWOT. In particular, about pragmatic impairment, it seems to be an independent and discrete domain, and it represents a core features of schizophrenia, not secondary to other symptoms, present in all the phases of schizophrenia, first level of psychosis, acute phase, chronic phase, and even in ultra high-risk patients, and strongly related to neurocognition, social cognition, mentalization, and psychosocial functioning. In this study, performed by Giulia Agostoni and co-authors, the authors demonstrated how also pragmatic deficit could be considered as a mediator between cognition and daily functioning. So there is also theory of mind that pragmatic is a great mediator between cognition and functioning in people with schizophrenia. Now I give you a little information about cognitive function in schizophrenia. As it is well known that neurocognitive and social cognitive functioning is a core feature of schizophrenia. And also, like pragmatic, it is present in all the phases of schizophrenia, prodromal phases, onset, remission phase, acute phase. It is present in third-degree relatives at a lower level, and it has an impact on psychosocial functioning and quality of life in patients with schizophrenia. Go on and talking about language disorder and schizophrenia, always with a focus on cognitive functioning. In this study, meta-analytic study of 52 studies, authors underlined that neurocognition, in particular all the cold cognition, was significantly associated with both positive thought and language disorders and negative thought and language disorders. And in the forest plot, here you can see the inverse correlation between thought and language disorders, positive and negative, and global cognition. Then go on, also social cognition, impairment, both in emotional perception and in theory of mind, that are two subdomains of social cognition, explain additional variance in speech disorders in schizophrenia patients. And it is important to know. Go on and go to the pragmatic aspect of the language. Neurocognitive impairment in attention, memory, verbal fluency, language, and visual special. There is a cognitive screening performed by ACE screening. These domains are related to pragmatic abilities, in particular with accurate figurative language comprehension, that is a pragmatic ability. In this area study, performed by Valentina Bambini and co-authors, they found a significant predictive effect of cognition for pragmatic production, and a predictive role of cognition and also theory of mind for pragmatic comprehension. A brief point about this project that Marta Bossia explained more deeply is of extreme interest, and the coordinator Valentina Bambini and Federico Fraut, with the other researchers from San Raffaele and Trento, they want to know the role of social cognition and executive functioning in pragmatic, means schizophrenia spectrum disorder, and with a meta-analytic approach, they proposed this model, the pragmatic sprout, and there is a figure that is a figure that I appreciated very much. And in this figure, we can link all the construct that we described in the previous slide. So executive function in level 1 influence pragmatics, level 3 by a direct way. But also there is an undetected indirect way that the executive function impact on pragmatics through the mediation of social condition. And it is also important for treatment, I think. Language disorders focus on rehabilitation intervention. Some brief points about cognitive remediation in schizophrenia, because there are some similarities that could translate from schizophrenia to language. And it is a behavioral training-based intervention that aims to improve cognitive processes, okay, with the aim, the goal of durability and generalization, okay, it is well known. And it is well known that it is an evidence-based intervention, also with small to moderate effect size in global condition and social condition. In this perspective, IPT, integrated psychosocial therapy, is an evidence-based integrated cognitive remediation intervention that address 3 of the important constructs, such as cognition in the cognitive differentiation software program, social cognition, and verbal communication. And it is about, sorry for the photo, and it is about 30 years ago, without evidence, okay, without evidence. The evolution of EPT, the first 3 program, evolved in INT, integrated neurocognitive therapy, that address more specifically social cognition and cognition identified by the Matrix initiative. And then it is important, worthy to highlight that INT is also in Italian language, and social cognitive and interaction training, so training about social cognition, are also translated into Italian language. It is important for feasibility and for the utilization in our services. Okay, this is some preliminary data from our research group, unpublished data, in which we found a difference between IPT compared to Tau group in favor of IPT, sorry, in 2 constructs of language disorder assessed by positive and negative syndrome scale. Lack of spontaneity and flow of conversation and conceptual disorientation. Go on at the final of my presentation. Here, this author suggests some describes some general treatment in language and communication disorders from a rehabilitation point of view, such as IPT, as you know. And most recent, such as cognitive pragmatic treatment and pragmacom, that I think they are Italian rehabilitation program, and this is the LCT performed by Valentina Bambini and co-authors that improved. It is demonstrated that it improves this pragmacom, pragmatic skills and metaphor comprehension in patient with schizophrenia. The last slide is this one. We have to remember some points. We have to better define language disorders in schizophrenia, but in particular their relationship and their interconnection with pragmatics, neurocognitive, and social cognitive function. We have to do and perform a better assessment with a better test harmonization, and we have to remediate, to address. Remediate is not a word I like, but to understand. We have to address cognitive domains that underpinning language disorders in pragmatic and in language disorders. So I think it's important to address the background, the ground, okay, and the conceive, design, and the validated new manualized time is finished. Integrated intervention, embodied cognitive and social cognitive remediation together with the neuro-linguistic rehabilitation is important. Perhaps in the first step, you have to remediate cognition, then social cognition, and finally pragmatics. Also, not only to improve social and non-social cognition and pragmatics, but also psychosocial functioning to achieve recovery. And the psychosocial rehabilitation in schizophrenia should no longer ignore language and communication disorders, including pragmatic, which have been neglected for too long. Thanks.
Time for one question. Please.
Do you think that it's possible for the treatment direction to go in the other direction? So for example, for pragmatic treatment to improve social and cognition?
Okay, and that was my question. I wanted to know. But I think that Martha will talk about after. Please.
I think that, thank you for your question. It's a good question, I think. And I think the right response is yes to you and Roberto. But I think no. Really, I think it is better to address in a propedeutic way first the cognition and social cognition, and then pragmatic. But it is my idea. I don't know. Also, with the hierarchical model performed by Valentina and Federico, I think it could be better to assess and do a training before to cold cognition and hot cognition and then pragmatics. But you have data to confirm my opinion, okay?
Thank you. Yes, we have preliminary data on that. Of course, I agree with the most appropriateness of the sequentiality, but we did see an effect of social cognitive outcome, particularly on empathy and theory of measures with the pragmatic training.
Yes. Thanks, Martha.
There is a last question because you have to run on.
Thank you. So I'm a social cognition person before I was a language person. And in my view, like, since I define theory of mind as the ability to attribute mental states and to like a person expressing something in a given, to me, the aspect of pragmatic that's linked to the pragmatic understanding is a synonym in the sense of theory of mind. That way, so like it seems like circular. So like if you're training it, like something that I would call theory of mind, but you end up like influencing theory of mind. So like I would like just to open like another debate about like how do we this theory of mind versus like pragmatic understanding, knowing that pragmatic like the production aspect, the comprehension aspect is different than this.
Oh,
So it was more of
please.
a comment than a question. Or a question, but that I don't think we can answer now.
Okay, it's an interesting question. I asked me when I started for this meeting, there's some similar question in my mind. And I think that there are overlapping area also, yes, absolutely, of social cognition and pragmatic. But for me, there is you have social cognition that well functioning, and so a good social cognition functioning is a necessary condition for pragmatic functioning, not sufficient, but necessary. Okay, and so there is some different in my definition. So a ground of social cognitive functioning conservated, and there is the base, the ground for a good pragmatic, I think. But there are many overlapping between the two constructs, absolutely.
If I can add one thing, is I should cut, but I'm not honoring my duties. But I think that if you think to mirror neurons and embodiment theories, probably pragmatics is a ring that connects my thoughts that have a language, your thoughts that have a language independently from other areas. So this will be a big challenge in the future for basic research, but not only. I think you raised a big point. Thank you. Now, I'm introducing to you Matteo Tonna from University of Parma and the local health service that will talk to us about toward unique sensory motor language biomarkers of schizophrenia.